In his early 40s, just after our children were born, Clive started acting strangely. He was made redundant from his job. Although he had lots of good qualifications, he couldn't find another job, and I couldn't work out why. He couldn't fill in application forms. And eventually, took a long time, he was diagnosed with dementia. And we didn't know why.
My dad was never, well, in my recollection, never ill until he had a problem with his shoulder. Kept putting it off and off and off, never sort of wanted to go and see a doctor, that was for sure. When he eventually did, we found out that he had a non-aggravated lymphoma in his shoulder. Within 3 months, we were told it went to his spinal cord, which was very unusual. And I don't think they really knew what or how to treat it at that point. And within a month of that, he passed away.
Our daughter died following heart surgery, and he didn't manage to come to terms with that very well. He became very depressed, very introverted, and we went on to have a son, Ben, but a year after that, Andy had taken his own life. It's difficult to imagine a post-mortem being performed on somebody you love, and people have religious beliefs that are against that kind of thing, but it was a helpful process for me.
There are two types of post-mortem examination. The first one is a consent post-mortem examination, which is sometimes referred to as a hospital post-mortem, and in that case the family want an examination of the body to find out answers to certain questions that they have. In the case of a coroner's post-mortem, the coroner is ordering the post-mortem to find out the cause of death, and because coroners also investigate homicide, the coroner doesn't need the consent of anybody to make that order. The coroner is the independent judicial official who's charged in law to investigate sudden and unexpected death of an unknown cause or unnatural death. The coroner has to know what the cause of death is, and in many cases the coroner has to order a post-mortem examination, and this is carried out by a consultant pathologist.
Well, once it's been agreed that a post-mortem should be carried out, the time and date of the post-mortem are fixed, the body is removed to the post-mortem room, and at the allotted time the post-mortem is carried out.
In the case of a coroner's post-mortem, the family do have certain rights, and those rights are that the family can have their own doctor present at the post-mortem examination if the family arrange that. The family also have a right to receive a copy of the post-mortem report, and the family have a right to know the time and place of the post-mortem examination. When the death's reported to the coroner has to make contact with the family. Coroner's officers do this on the coroner's behalf. Coroner's officers are there to gather information for the coroner that the coroner needs to register the death, but also the coroner's officer is there to answer any question that the family may have.
The coroner's officer was one of the first people to arrive. He was a police officer, so he arrived with other officers and was the person who was asking me the questions and making notes of my answers, effectively taking a statement from me, inquiring about the state of Andy's mind, how long he'd been depressed for, and what treatment he'd been having, and things like that. He was like a named person who was there in all this hustle and bustle. He was an individual who, kind of spoke to me quietly and said, "This is my name, here is my card, this is how you contact me." So when it came to the point where I had further questions to ask, I could go back to him. I knew where to find him, how to contact him.
The coroner, if there is no other way of identifying the cause of death, will have to order a post-mortem examination. Now, coroners nowadays are well aware that there can be religious and cultural objections to post-mortem examination. Coroners fully understand that many religions believe the body suffers after death. And of course, a post-mortem will not be ordered unless it's the only option necessary to identify the cause of death.
When we do a post-mortem, we can look at the organs and the tissues of the body, not only in the natural state, but also under the microscope, and that can give us some very valuable information.
If Clive hadn't had the post-mortem, I wouldn't have known what had killed him. I wouldn't have known what the illness was. I would have thought, well, maybe he had pneumonia. Okay, it's a serious illness, but if we'd given him antibiotics, he would have been back to normal within a couple of weeks. In fact, he would have, if we treated the illness, he'd have been an invalid for months. So it did make us feel that we'd been correct in what we'd done. And I found that, and I go on finding that a comfort.
We were approached by the oncologist to find out whether we would agree to a post-mortem. As I said, with Dad having very unusual symptoms during the last certain couple of months of his illness, they were also very interested to sort of pursue more what had gone on. My dad's death certificate stated that he died of pneumonia, which was a bit of a shock to see, and it was really due to the post-mortem that we later found out that it was a very unusual lymphoma, aggravated lymphoma of his spinal cord. And without the post-mortem, I don't think we would ever have found that out, and it would have been very difficult to accept that he died purely from pneumonia.
Post-mortems are the most accurate way of establishing a cause of death. It's been shown in various studies that what the ward doctors think is the cause of death may be wrong in up to 10% of cases, and that can only be shown by doing a post-mortem.
I don't know if they think that once they're dead people sort of stop caring. That's not true. Obviously we're here to do a job, and as far as we're concerned we are sort of nurses for dead people, so obviously we care for them, we respect them, and we do everything, we treat them the same as we would a live person.
A post-mortem usually begins with an examination of the body externally. That's followed by an internal examination of the major organs, and obviously that does require cutting the body in order to be able to examine the organs.
We remove organs to examine them. They're examined and put straight back into the body. That's all organs, unless the family have given signed consent to say that, you know, organs are going to be left for research or anything like that, and that is entirely up to the family. Otherwise everything will go back.
Once the internal examination has been completed, if there are major findings, some tissues from those particular organs can be taken, and those will be examined at a later date under the microscope.
The initial autopsy is just to find an immediate cause of death, because Clive actually died of a separate illness. That result came through quite quickly, within probably a week or so, and that told us what had actually killed Clive, because although we knew he was very ill, we didn't know why. The assumption was it was something like pneumonia. In fact, the initial post-mortem showed that he'd had an infection around his heart muscle. Sometimes it's necessary to retain whole organs in order for that examination under the microscope to be easier. The brain is one organ which requires what we call fixation before it can be looked at under the microscope adequately, and fixation takes at least 2 weeks. You can look at the body cells quite quickly. You can look at somebody's heart, but you can't look at somebody's brain without preserving it. It's just squidgy. You have to preserve it, you have to stain it, you have to look at the cells under a microscope. And it's a very, very specialised job. There aren't very many people that can do it.
If the pathologist needs to retain a whole organ, such as the brain, or any other large section of tissue, then the family will be given various options with regard to when the funeral can take place. The first option is that the funeral could be delayed until the tissues return to the body. Funerals are very important at this time, and families often want funerals to take place very soon after death, and therefore the second option is that the funeral can go ahead straight away, with the tissue being returned later on for a second interment. The third option is that the funeral can go ahead straight away and the hospital can dispose of the tissue. And the final option is that with the consent of the family, the retained tissue can be used for teaching or research, with the funeral going ahead straight away.
Someone would come into the room with you, first of all, and your relative would be lying on something like this, you know, with their head on the pillows and the sheet just covering them. If you wanted to, you could lift the sheet back and, you know, hold their hand or anything. Normally what we tend to do is we come in with you and then we ask you if you want some time on your own, because a lot of the time people have got things to say and they don't want other people to hear. And we just wait outside for them, give them as long as they need. And if they want us to come back in, sometimes they say, can you come back in with me for a little while? And we do. If not, we just leave them until they're ready to come out.
He looked peaceful. He looked more like the Clive that I'd known and less like the body fighting for breath. I would have been quite happy to take the children, who were then about 9 and 10. They didn't want to go. But he just looked like, I mean, I won't say he looked asleep. He was obviously dead, but he looked like my husband. And I got a chance to say a final farewell to him.
I was told at the initial scene at our home by the coroner's officer that there would be a post-mortem, which I knew anyway, and that was fine. And I was also told that there would be an inquest where people would give evidence, including myself, about Andy's state of mind to help the coroner determine the cause of death, which was what the post-mortem and the inquest is for.
At the opening of the inquest, the coroner issues either a burial or a cremation form, along with an interim death certificate, and those documents enable the funeral to take place and also the family to deal with any banks or other institutions that need proof with regard to the facts of death.
The coroner's verdict has helped enormously now, looking back. You know, Ben is now 10 years old, and we have discussions. He obviously asks about his father, and having that verdict, it helps me to be able to explain to Ben that actually his father was ill, and that's why he took his own life. It's not because of anything we did or that he didn't love him. It was an illness that resulted in his death.
What we're there to do is to register the deaths of loved ones and to find out answers for society generally, but particularly for the bereaved, as to how the loved ones died. And therefore we do provide a service for the living rather than for the dead.
Postmortems benefit relatives by establishing the cause of death and allaying their fears in certain situations. They benefit medicine as a whole, and they also benefit society by enabling doctors to develop therapies that can then be used for future patients.
It's very great comfort to his family to know that there's nothing, that they're not likely to be affected by the same illness, that it was a pure one-off and bad luck for Clive and not something that runs in the family, because his brother's coming up to the age now at which Clive fell ill. And it would have been awful for him to think that perhaps every time he went upstairs and forgot what he'd gone for, that was the beginning of this illness coming for him.
He would have been very positive about it. I think if it would help, either for us to know or other people, yeah, he would have been very positive about it.
His children aren't interested at the moment. They just want to get on with their lives. But I know in the future they will want to know what happened to their father. And I can give them as full an explanation as was available at the time. We couldn't have done anything else to help him when he was alive, or to find out what killed him.
It was, I suppose, almost like a final farewell, really, that we had some answers, rather than not knowing.